I mean, to describe autism as a mental disorder in this day and age is archaic, and to align the two is basic hygiene. We've got to get that right.
So welcome to Political Sandbox by Chamber today, Robert. As you know, this is an interview with you to discuss on the topic of autism and neurodiversity. My name's Tim Nicholls. I'm the Head of Policy, Public Affairs and Research Partnerships at the National Autistic Society. And I've been there for now most of a decade. My journey in autism started much earlier than that. My older brother is autistic. He went to one of the National Autistic Society schools, Radlett Lodge, a couple of weeks after I was born, so I feel like my journey there is substantially longer than the 10 or so years I've actually been working there. But I wondered if we could start off by you explaining a little bit about your own personal interest and policy and political interest around autism and neurodiversity and the work that you've already done. Obviously we'll get to go into a lot of that in a bit more detail in just a second as well, but just to kick us off.
Well, my involvement long predates my election to Parliament back in 2010, because I have a family experience of my own. My daughter was diagnosed when she was about 4 with autism and other conditions, which was a very important moment in all our lives. You go through a moment of acknowledgement, relief to get the diagnosis, guilt, sorrow, all the other emotions that so many parents and carers up and down the country have gone through. And then you get a sense of, well, what's next? What's the plan? What provision is there? And I think from my own experiences, I've learned a lot about the challenge that faces many families. I think that in the years since, and it's now 15 years since that event, there's been a lot of improvement. I think diagnosis levels have risen. I think that the way in which autism and neurodiverse conditions is identified has improved. But there is still a huge amount to go, not just in terms of waiting for diagnosis, but also in terms of post-diagnostic provision, particularly for adults with these conditions. And that's why when I became an MP, I thought that I should use my lived experience to I hope, best advantage in terms of helping not just constituents with similar problems, but to talk about it on a national stage, to work with organisations like yours, to promote awareness and to improve provision. And looking back as a backbencher, having worked with the NAS and others on the Children and Families Act 2014, NICE guidelines for the Commission of Services relating to autism, we achieved a lot. And in government I kept the agenda very much alive, whether it was as Solicitor General dealing with disability crime or as Lord Chancellor commissioning and publishing a report on neurodiversity in the criminal justice system, which I hope will be the basis of an improvement in the way that people with neurodiverse conditions are supported when they get into a system that, shall we say, isn't really designed to deal with and support those conditions.
Of course, back in that early first term, you were chair of the all-party parliamentary group on autism as well, and it really was a critical time. You mentioned some of the key things there: the Children and Families Act, the NICE guidelines, the Care Act. All of those things were going through at that time, and those are the things we're still waiting to see them fully, properly implemented in many cases. I suppose just to start off, perhaps maybe with your reflections in particular around the understanding and awareness of autism. Obviously, like you said, your personal journey on this is substantially longer than your political one. Where do you think we are on public understanding, perceptions, misperceptions on autism? What's the challenge?
I think the public understanding of autism, the term, I think is very wide now, which is good. I think the depth of understanding is not where we need it to be. It's understandable on many levels. If you haven't had a direct lived experience or family or friends experience, then it's perhaps difficult to apply what you know in practice. I think that we've gone a long way in dealing with the urban myth about autism and women and girls. I think when I started, my daughter was the about only the first or second child in our local area to be diagnosed, a girl with autism, which is extraordinary when you look back at it. I think that is changing. But I also think that we've still got work to do about avoiding stereotypes. Oh, you're autistic, you don't look at me. All that sort of stuff. You and I know that if you've met one person with autism, you've met one person with autism, and there isn't actually a stereotype or a one-size-fits-all categorization for this. And I think that as we develop terms and refine and change the way we describe and view it, we're actually getting a much clearer impression of what is quite a large spectrum here, with conditions that sometimes perhaps don't actually meet the criteria for an education, health and care plan, but which are significant enough to be a barrier either to learning or to accessing important services that could make a difference in terms of employment and other opportunities that I believe people with autistic people are entitled to have access to, just like anybody else.
It's interesting you brought up education and those development of skills and the learning that happens in schools and preparing people in particular for adulthood, a world of work or a world of doing the fulfilling things that they would like to do. So I'd like to come on to those a bit, and then perhaps we'll talk about some of the things you dealt with during your time in government as well. But you've spoken in recent months about your wish to focus in particular around that preparation for adulthood, getting the right start in life, getting education support in nice and early, so that when autistic children go on to be autistic adults and go out into the world of the work, they are more prepared. And I wonder if you can talk a little bit more about the problems that you see in that area. You rightly mentioned there that not all autistic people will qualify for, or perhaps even need, an education, health and care plan, but what they might need are some other reasonable adjustments in the classroom and an all-important understanding. And I was just wondering if you want to share your reflections on where you think we are at the moment and what the key challenges coming up, bearing in mind we have a special educational needs and disability review due out in the next few months.
Which is a big moment, I think, again, for us to really seize upon. Look, I think the system is still too reactive. If you have, a particularly activist parent, if you like, who's taken, who's asked questions and knows the system in a way that not all parents are equipped to do, which is, another story. You can get your child's condition identified, and then you can ask for reasonable adjustments, whether it's longer time in exams, the use of laptops, all those things that make your child's particular learning disability, whether it's dyslexia, ADD or whatever it might be, just that little bit easier to handle. Now, but that's a reactive system. It's not a proactive system, actually doing the screening and assessment that I think would be hugely beneficial for all children, to actually go out there and identify what's going on. And to be ready then to identify all conditions from dyslexia, dyspraxia, right through to ADHD and other concentration affecting conditions that are barriers to learning for far too many children. And just think, by spending resources doing that, we can save resources on the cost of school exclusions and the disruption to other children that is caused by a young person without that diagnosis not being able to access the curriculum in a way that I think they could with proper identification.
Obviously, diagnosis waiting times are astronomically long in the country at the moment, and following the pandemic, it's still not entirely clear exactly what kind of impact that would have, but it's certainly not going to have decreased those waiting times. Do you ever get a sense, do you ever see those parents coming in who are told that they have to wait for that diagnosis before anything can be done at school, before an EHC plan can be considered? And what do you think about that? Is that one of those systemic things that needs tackling too?
Most definitely. Waiting times, I've looked at this from a local level, whether it's waiting times for clinical diagnosis or waiting times on CAMS, because let's face it, some of these issues then become a comorbid mental health issue. And actually, resources are becoming less of an issue. It's the capacity of staff and the recruitment of new specialist staff to help deal with the cases. There just aren't enough qualified people who are available to do that work. That's one of the big challenges, I think, facing a lot of professionals and commissioners, and indeed commissioning bodies and those providing services up and down the country. Now, you can't magic up specialist clinicians. We just can't. So in the meantime, there are surely things we can do and adjustments we can make in class for youngsters who clearly have got a challenge and an issue, might be, really struggling to spell or make sense of numbers. And the training that I know teachers and TAs have been given is invaluable in this. And, I trust the quality of a lot of our teachers who really do want to get to the bottom of some of the obstacles facing the children they're teaching and want to provide that extra help. Now, a lot of schools are doing it really well. I think the answer is that, schools increasingly are talking to each other, learning about best practice, and through that, making those adjustments that I don't believe are that costly, but which can make a real difference to the quality, not just for the child, but for the other children around who themselves might be affected if the particular child isn't getting the sort of support that they need.
I couldn't agree more on that. I think we've recently done some work alongside the Autism Education Trust, which is a partnership with the National Autistic Society, ambitious about autism. It does a lot of that, working with schools to bring them together to talk to each other and to share those training things. And actually, in some of the areas where they have worked intensely with both the councils and the schools, they've not only seen that it hasn't had a negative cost impact in that it's costing more money, they've seen it save significant amounts of money. And a big reason for that is actually the number of exclusions of autistic children in particular that it stops, because we know exclusions are currently far too high. And we also know that exclusions can be the start of things starting to go very wrong in people's lives, and that pathway can sometimes lead people towards something that you've come across in particular in government around criminal justice. So I wonder if we can just turn to your work in government as Justice Secretary and Lord Chancellor. While you were there, you were a really strong advocate for autistic people, all neurodivergent people, kicked off a lot of work there. Lovely for you to speak through briefly. But in particular, you were talking about screening, and by screening I don't necessarily mean dogmatic questionnaires that have a fixed outcome or a particular thing, but identifying people nice and early. And I wonder if you've spoken a bit about how that impacts positive education, how that can impact a positive experience of the criminal justice system, which people don't often think of.
Well, they don't. They need to, because I'm afraid there is sometimes an inevitable link. The excluded young person might end up being exploited, vulnerability exposed, or a particular susceptibility. The county lines phenomenon involves the exploitation of children who are in vulnerable situations. It's abuse. And this is what really spurs me on. I think about these children as continuing victims, frankly, of a system that isn't working. It's working against them, and the cost emotionally, morally, in terms of society, and financially of seeing young people ending up in the system with undiagnosed conditions is just too much to bear, I think. And there is definitely a higher incidence in our youth estate and in our adult prison estate of people with lifelong brain conditions. A lot of it might be an acquired brain injury, but a lot of it will be the range of conditions that we've been talking about today. And that's why I think screening of people coming into the prison system and the criminal justice system seems to make eminent sense to me. I think beginning before that, at the stage of sentencing, the preparation by the probation service of a thorough pre-sentence report with suitable clinical evidence is a vital part of the sentencing process, which can make the difference between a term of imprisonment and a community-based sentence that could finally give intervention and support to the particular defendant. And I want more of that, and that's what was driving me on when I was in the department. And as part of my sentencing white paper, I announced a call for evidence on neurodiversity, which resulted in excellent work by Her Majesty's Chief Inspector of Prisons, Charlie Taylor, who you will know has a considerable background in SEN and particularly in autism, and Justin Maddis, who's the head of the Inspectorate of Probation, and they together worked on first of all, a call for evidence that produced, I think, a very interesting body of information that was then turned into a very helpful report that I think gives government a very clear policy basis upon which to operate. And that certainly was my intention when I was in office. We'd started that implementation, and I very much hope that my successors carry on. And if they haven't been to the wing at Her Majesty's Prison Park in South Wales to see what can be done with autistic prisoners, then they need to go and see it. And only a couple of weeks ago, that particular wing was commended and singled out for praise by the Inspectorate as an example of how, not just to manage people, but how to get the best out of people with those conditions whilst they're in the custodial prison setting. So we've got some great examples of how it can be done. We now need to see that much more systemic and embedded in the system.
We're waiting for the government's formal response to that call for evidence, and like you say, we really hope that it leads to taking forward a lot of those really good ideas, especially around improving awareness and understanding of the professionals in prisons, about looking at what screens work, how they can be embedded in prisons as well. I think there's a huge amount of good work to be done there, and the work that HMP Park has done, I think, has been incredible to date, and it's certainly something that could be replicated across prisons around the country. I wonder what you think about, obviously, a lot of the work that you've done quite possibly could be described as stuff to tackle when things have gone wrong. You're working at a point of failure, essentially, in the system. If an autistic person has found themselves in court either mistakenly, wrongly, or having committed a crime, many of those situations could be avoided if support were in place earlier on, if understanding had been in place earlier on, they'd had a better start in life. And that just brings me back around to one of our last themes to explore today, which is the National Autism Strategy. And of course, you will have been involved in several of these autism strategies now, first in your early days in Parliament, with the first one, and then the second one coming on, and obviously now we're in the third, which you were involved with as one of the ministers responsible. What kind of role do you think the new National Autism Strategy, which includes some of those criminal justice things that you were talking about, could play in transforming the lives of children and adults who are on the autism spectrum now?
Well, look, I think the revised strategy is a really excellent document. It incorporates a lot of the latest thinking, and there's a sense of ambition there, which I think is laudable. But we've got to do it. Governments are fantastic at producing glossy strategies and plans, but it's the implementation that matters now. And under the NHS long-term plan, in terms of the funding of all of this, that shouldn't be a question mark anymore. We need to just get on with it. So take autism research. The government has promised that they would get on with spearheading important research into better ways of supporting and intervening to help people with autism. Well, let's do it, shall we? And the first debate I did as a backbencher in Parliament was on that very issue about how we've got a lot of evidence of good practice. Let's spend some serious money on, and it doesn't have to just be government money. There's private sector involvement as well here to highlight what works and to spread it out. Now, there's no time like the present. Let's get on with it. And I think my message, I suppose, the thread through the couple of debates I've had already in Parliament has been, look, you've got the plan. I've read the plan. I helped write the plan. Get on with it, and it's not about nudge now. For me, it's about shove, particularly on issues like the detention under civil powers of autistic people pursuant to the Mental Health Act, which we all know is a standing reproach. The government is very clear that it wants to end it. Well, we need to see actions.
Absolutely, and many people who are watching today will have seen your adjournment debate just last week, exactly on that topic. And anyone, frankly, who hasn't seen it, I suggest they go and look on the Parliament website, because it's a really good debate. And actually, I think what was noticeable that everything you were saying around how old-fashioned that law is, how much of an anachronism it has become in modern day life, how much support there was across the House for it. And we know this is a cross-party issue that there's support for.
I mean, to describe autism as a mental disorder in this day and age is archaic. And to align the two is basic hygiene. We've got to get that right. Now I know the problem. Local people watching in local authorities are going to say, and they're right to say, look, we haven't been able to commission the services. We've got capacity and resource issues. The NHS has got the money. It's far too tempting to just park them in NHS-funded facilities because local government, and it's not a criticism, just hasn't got the ability to deal with community-based services. And no doubt they're going to quail at the thought of another statutory duty coming on community-based services, which is what the government's policy is on reform of the Mental Health Act. So therefore what we've got to make sure is that we end this sort of pillar-to-post approach and genuinely, in the first instance, get community-based services that prevent the escalation to crisis, which is what each of these cases sadly represents.
And one of the things that's going to be pivotal to making that happen is there are two things I think. One is about making sure that the autism strategy is implemented at a national and a local level, and I think it's really good to hear you talking about not just nudge but shove. Might use that one in the future. Give government, local and national, a jolly good shove on it. But also it's going to be about social care reform. We know that plans have been in the offing in one way or another for about 30 years, but this government has nailed its colours to the mast on this and said it's going to fix the social care funding crisis. In order to make everything we've spoken about today happen, pretty much, what would be your message, firstly, to the national government around social care reform, and then, importantly, to local government, to councillors, to officials up and down the country, many of whom will be watching?
I think the first message is what the government's doing is brave and good. I was in Cabinet when we signed off the decision to increase national insurance, controversial and difficult decision, but we had to start somewhere and we had to grasp a nettle. I think that the white papers that we've seen thus far, and we've got another one coming on integrated services, are really, the building blocks of the policy. I was very encouraged to see heavy reference to accommodation and housing issues, particularly when it comes to adults with lifelong disabilities. And I think people watching will know that I, through various comments, expressed my concern about the way in which that is to be funded and the way in which the cap and the floor are to be calculated, particularly for adults and families of adults with lifelong disabilities who often will need decades of care as opposed to the average few years care that older people will get. And therefore I think the moment to shape this policy and to really get an influence on it is now. I think local authorities are rightly nervous about ending up in a position where integration just means more bureaucracy. And with the best will in the world, we've seen in Greater Manchester a genuine attempt to try and integrate, which from my reading actually led to more paperwork and more of a bureaucracy in order to manage those public funds. Now, I don't think that was anybody's intention. I don't, criticise anybody, but that's clearly not what we need here. What I think we need is far more a sort of patient or client-centred approach, which we pioneered individual funding for certain aspects of life for people with disabilities. We need to again just look at that model to see how we can genuinely centre the funding around the individual, because there will be a myriad of different cases and different needs, and try and devise a structure that is lighter on the process, given the fact it's public money, but much more focused on the outcome. Now, it's easy for me to say that, but I don't believe it's beyond the wit of commissioners or authorities to devise such a system which truly, centres itself upon the people we're supposed to serve.
And getting that care that's focused on the outcomes that people want obviously has to be based on solid understanding of autism or any condition that the person that is going to. So it all kind of comes full circle back to understanding of.
So let's give an example. Local authorities quite rightly worry about out of borough, out of district placements. They're very expensive, tens of thousands of pounds, sometimes a month, are being spent on individual cases, particularly acute cases. They're quite rightly looking for ways in which they can spend that money better. And what is better for me is in the community supported services that then allow for sensible interventions to make sure crises don't happen, so that ultimately you might be spending over a longer period, but you're spending less over a longer period on less acute interventions. I think that's a win for everybody. It's a win for the client, it's a win for the individual who isn't going into crisis, and it's a win for the taxpayer and the local authority who aren't having to pour millions, sometimes millions, into just one or two cases.
Yeah, absolutely. I mean, even just from a personal perspective, to say my brother has never lived in county, well, since he was 6, because it was that county, I won't name it and shame it, has never had the appropriate services in the area to actually meet his needs. And it was a decision that my parents took back when he was very young, that it would necessitate him going out of county, and kind of that's where he stayed. Now, if that landscape had looked different back then, maybe it'd be very different. But I know that families across the country are often facing hours-long drives, either for their kids to go to school, for them to go and visit their adult child, or in the worst situation, actually, sometimes we see children or adults who've been admitted to hospital who are at the other end of the country. Yes. And all of these things are driven by that kind of lack of local commissioning and really owning kind of autistic people and the outcomes that they need. In many ways, I think it's too often people are seen as a number on a balance sheet in terms of shuffling things around, and nobody who's working with them actually anticipates or wants that to happen that way. But the system sometimes conspire to perversely incentivise that. That covers off all the questions that I was going to ask you today, but don't want to send you home without having an opportunity to say anything else you wanted to say. So if there's anything else that you did want to raise today around autism, neurodiversity, and...
Having been close to this issue for so many years, I think that, well-intentioned though the system is and those who run it are, we're still too reactive. There isn't a real sense here that we have yet got a truly proactive, anticipatory interventionist system that deals with the issues at source, and then, from there, benefits will flow. I know that's everybody's intention, but we're not there yet. And that's why I think that it's not just for government to be involved, it's for the private sector, for business, for all parts of our life to really put its shoulder to the wheel to demonstrate that we can together provide better support, make better adjustments, and allow, we're talking here about hundreds of thousands of people to fulfill their potential, whether it's in working life, academia, public life, whatever it might be. These are people, people with autism have huge potential, and instead of always looking at it as a problem and as a dependency issue, we should be looking at the potential of autistic people, the wonderful myriad of different talents they have, and opening that up in a way that truly will, improve the lives of hundreds of thousands of people and their families too.
I think it's a really inspiring message to leave on, that avoiding reaction, being proactive. I wonder, do you think, we often talk about spending when it comes to issues around care or people with disabilities, any number of things. How much do you think we should be moving from spending to investing?
I know sometimes investment was a bit of a euphemism used by previous governments, but actually there is a genuine case for what I'd regard as spend to save. And I think that's the good way to look at it. Yes, there are public resources that we need to spend on these services and these provisions, but think of what you can save further down the line by making the right interventions, the proactive interventions at the right time, whether it's education, health, or indeed in employment as well. So we've got the plans. Now we need to get on with it.
There we have it. We've got the plans. We need to get on with it. So thank you, Robert, for speaking with us today. That wraps up the interview. Just wanted to say a couple of words about Chamber, who are the people who have organised today's interview. Chamber is the community voice, and you can join the conversation that they are facilitating by following them on Twitter @Chamber Voice, on Instagram @Chamber UK, their website info@chamberuk.com. Thank you very much for joining us today. Thank you, Robert, for joining us today. Look forward to working with you a lot in the future to, as you were saying, get the autism strategy done. Let's do it.
Thank you very much. Great pleasure to be here.